Hello, I'm Bill Van Gorder, Chief Operating and Policy Officer for CARP. We know that health is important to you, and that's why a lot of our CARP advocacy work and information campaigns are centered around healthcare and your overall health concerns. Sleep plays a big role in your health, so issues like sleep disruption and insomnia are serious matters for many members. But there are steps you can take to minimize their impact on your quality of life. I'm pleased to welcome you to the next in our exclusive Explained series of virtual summits. Today's edition is Better Sleep Explained. We've gathered a number of experts who over the next hour will explore the key elements of achieving and sustaining a restful sleep. So welcome. Sleeping Better starts now.
CARP presents the Better Sleep virtual event, sponsored by WellWise by Shoppers Home Healthcare Solutions. Join us to learn how important good sleep really is. Delve into the science of sleep with solutions for better rest and improved health. Speak with experts and have your questions answered. Learn about products, services, and new research on the science of sleeping better. Live from the Zoomer Media Studios in Toronto is Natasha Ray. The Better Sleep Explained virtual event begins now.
Good morning and welcome to Better Sleep Explained. I'm Natasha Ray, joining you live from Zoomer Hall. 80% of Canadians don't get enough sleep, and that certainly affects our quality of life. I'm one of the lucky folks who can fall asleep and stay asleep, sometimes a bit too long if you ask my family. But the vast majority of Canadians are battling some form of sleep issue. Today, we are going to be discussing sleep, starting with Dr. Iris Gorfinkel. Dr. Gorfinkel is a family physician who maintains a full-time general practice and participates in clinical research. She's here to talk to us about why we sleep and why we need to sleep better. Welcome, Iris.
Thanks so much for having me.
Thank you for joining us today. So I'm going to start by asking you, what is the role of sleep in overall health and longevity?
I'll answer that question with another question.
Okay.
What part of life does sleep not affect? In my view, we're being far less too aggressive in treating it and understanding it. So when it comes to physiologic, both mental and physical health, it makes a tremendous impact. It's used as a torture in some parts of the world because of that impact. So I think we need to make the most of what it can do for us physically and emotionally. There is no psychiatric illness that is not associated with a lack of sleep.
That's an interesting fact. I didn't know that. But one of the things you and I both know is how important it is to keep your family doctor involved with all of your healthcare needs. So if someone is having sleep issues, when should they see their family doctor?
You know, it's such a simple answer, but the answer to that is actually when they feel tired. Okay. If a person feels tired, it's a subjective thing.
Right.
That's what determines it. And moreover, if there's a change from what the baseline was. So I was one way before, and if that baseline has long been, I'm a little tired, but now it's changed. That's what I look for as a GP, and change from that baseline.
So when you talk about baseline, you mean, so if I was sleeping 8 hours a night and it was wonderful, and then for the last 2 months I've been sleeping 4 to 5 hours a night and it's terrible sleep, that means the baseline has changed. Like when do you start to think, okay, this could be a problem now?
Right, so there's that number, but there's also subjectively, a person with sleep apnea, for example, could sleep for 10 hours and yet have literally 30 minutes of nutritive or good quality sleep.
And that's another good point, because just because you've had a long sleep, it's about quantity versus quality. The quality is more important than the quantity. So what are some of the common things that disrupt someone's sleep? And I know as you start to list some of these that I probably am the culprit of all of them, but just for fun, why don't you tell me?
Well, you know, let's divide it up into two categories.
Okay.
There's primary sleep problems in which the sleep architecture has been disrupted. You know, so that would be things like obstructive sleep apnea. And then there's the far more common thing. This is the mundane stuff that a GP does. What keeps the vast majority of people awake? Why can't they sleep? The answer to that is stress.
Yes.
Stress is by far the most common. But as a GP, I'm looking to exclude other things, physical things, serious emotional problems. You know, so as a GP, I come at it from the perspective of, let's start with the wide umbrella so that we can better understand what it is that your body is trying to tell us by this change.
And is there a specific type of person who tends to suffer from sleep issues more, or it is sort of across the board, like it could be any age, any gender, any ethnic group?
Oh, absolutely. It's pretty much everybody.
Right.
But the common things being common, you know, caffeine and alcohol play a tremendous role in disrupting sleep potentially.
So sometimes people think, well, if I just drink a few glasses of wine, it'll help me feel more relaxed and then I can go to sleep. But is that the quality of sleep that you want? Like, how does alcohol consumption actually affect your sleep?
What's interesting is that alcohol is a sedative, and there's a difference between sedation and sleep. So what does alcohol do? Alcohol disrupts the sleep architecture, making it harder, actually, to get a nutritive night of sleep. The sleep tends to be more fragmented. In other words, people wake up more frequently. Even though they can fall asleep a little more easily, what we have is sedation. And alcohol also impairs what we call REM sleep. That's the sleep that's nutritive and gives us a sense of having slept well. It tends to happen more at night, and alcohol targets REM sleep to damage it.
That's good to know. And so if I wanted a real nutritive night's sleep, like, what do you recommend? What is your best advice for how I can do this?
Best advice?
Yes.
Make sure that the room is dark. If I had to say the one thing that was most important, same time to bed, same time up every single day. Caffeine, and this isn't popular to say, but alcohol actually belongs in the morning, because if you're having it at night, what ends up happening is that it does disrupt your sleep. It's more likely to do that.
Alcohol belongs in the morning.
Well, you
heard that here. Alcohol belongs in the morning. Okay.
No, what you heard here is this. Let's be aggressive about sleep.
Right.
Let's take sleep as seriously as we take diet. We're not doing that right now.
Yeah.
We take diet so seriously. We think about paleo, we think about veganism, we think about all this stuff. And what happens to sleep? It gets relegated to the passivity of life, and that's not acceptable. We have to think of it in terms of a proactive thing as important as exercise. How am I going to ensure a good night's rest? So the list of sleep hygiene: keep the room dark, keep the room cold, same time to bed, same time up every day, including on the weekends. This stuff matters. Exercise, we know it improves both the quantity and the quality of sleep. Diet, exercise, sleep, these are fundamental to cardiovascular health, to psychological well-being, and to staving off dementia.
And these are the things I've heard constantly, is about the exercise and falling asleep at the same time and waking up at the same time. And certainly the fact that I fall asleep to a different murder show every night probably is not helping with my own nutritive sleep.
Well, the idea is 1 hour before going to bed, it actually makes a difference.
Right.
By 50% in terms of how quickly people fall asleep, just turning down the lights. This one simple thing, you turn down the lights, you stop, and this is so hard to do, you stop looking at your mobile device, because that mobile device will keep you awake. So there's all this stuff about blue light, but it's also the stimulation that goes into it. You know, the FOMO, the fear of missing out, oh my gosh. And then what winds up happening is your mind is extra active. Yes. The meditation makes a huge difference. You know, number one thing, stress. So you've got stress that you can actually control and stress that you cannot control. And I think what meditation does is it allows us to rise above those things that we cannot control, concentrating on our breathing, concentrating on how we're actually feeling, our sensations in our body. And that in turn leads to a much more nutritive night of sleep, as opposed to sedation that happens from drugs. And we know those drugs. I'm talking about the benzodiazepines. I'm talking about the Ativan, the lorazepam, clonazepam, Valium, diazepam. These drugs on the negative list. Yeah, they'll put you to sleep. It's not sleep. Remember, it's sedation, different architecture altogether. And they make people forgetful. They make it more likely they're going to fall, more likely they're going to fracture, and less likely they're actually going to have a nutritive night of sleep.
Well, I really like your message. We need to be aggressive about sleep. So thank you so much for joining us today. I know this was very insightful for me, and I'll work on having a more nutritive night's sleep. So thank you.
Many thanks for having me.
Thank you. Next up, we have Sonia Cardozo. Sonia has worked as a registered respiratory therapist in both the hospital and home care settings for the last 6 years and has a strong passion for education and teaching. In her current capacity as CPAP supervisor at Wellwise by Shoppers, Sonia provides direct patient care as well as clinical support to CPAP consultants in the GTA. Welcome, Sonia.
Thank you for having me, Natasha.
Thank you so much for joining us today. So the first question I'm going to ask you is, how much sleep do we really need?
Yes, so personal sleep needs really depends on the individual as well as their age. However, most sleep experts say that we should be getting anywhere between 7 to 9 hours of sleep. But there's two main universal factors that really determine our sleep. So one of them is our biological clock. So that is that internal timekeeper that regulates the hormones that keep us awake and asleep at night, and our sleep drive. So basically that is the principle that the longer you are awake, the stronger your drive for sleep will be.
And so what happens to our bodies and our health if we don't get enough sleep?
For sure. So of course, sleep is very crucial to our overall health and our well-being. When we sleep, our bodies restore themselves, they repair themselves, we manage our hormones, we flush out toxins, and we also file our memories. So of course, without good quality sleep, a lot of negative consequences can occur, such as increased risk of developing heart disease and stroke, as well as cognitive decline.
And so when we just spoke to Dr. Gorfinkel, and she mentioned that anyone can be affected by sleep issues, but do sleep issues actually get worse as you age?
So not necessarily. There is a public health statistic that says 1 out of 3 Canadians under the age of 64, as well as 1 out of 4 Canadians between the age of 65 and 79 are just not getting enough sleep. But there are definitely a lot of factors that aging Canadians do face, such as chronic pain, increased sedentary time, stress, insomnia, as well as untreated sleep apnea.
Which we will talk about later.
Yes.
So when we look at the quality versus quantity, so if I'm getting 7 hours of sleep and it's really good sleep versus 10 hours of sleep where I barely hit the REM stage of sleep, like is there a difference between the quantity and the quality of sleep?
Absolutely. So like I'd mentioned, experts suggest that we should get anywhere between 7 and 9 hours of sleep. However, practicing good sleep hygiene is what is going to get you good quality sleep. So just a few things such as, going outside every day, getting sunlight. Daylight really helps to regulate a healthy biological clock. Limiting napping during the day, so less than 30 minutes a day is recommended because that will then affect your nighttime sleep. Avoiding stimulants, so nicotine, caffeine, any type of alcohol should be avoided, as well as large meals because, if you're eating too close to bed, you might have upset stomach or indigestion, which will affect that. And lastly, which is one that we are all guilty of, is limiting that phone or screen use. Trying to avoid that cell phone or the TV before bed because the light that is emitted definitely disrupts those hormones that help us to relax and fall asleep.
And what do you do to get a better night's sleep? Like, what is your top thing that you do?
Absolutely. So I think the one thing that I do try to do every day is sticking to a consistent sleep schedule. So trying to at least go to bed around the same time and wake up at the same time every day. By keeping that consistent, that will make a huge impact on your quality of sleep.
And so summits like today are providing a lot of information for people around sleep. But even after this summit, like where can people turn to get information about better sleep?
Of course. So obviously, our CPAP consultants at wellwise.ca, we have a wealth of information regarding sleep as well as sleep apnea. Wellwise.ca has a lot of information there as well. And of course, reaching out to your family doctors. They're a really great resource for everybody.
So the next question I have for you, I kind of already know the answer because my husband has this, but could you tell me what is sleep apnea? Because it's certainly a term that people hear all the time, but what exactly is it?
Yes. So sleep apnea is a potentially serious sleeping disorder where our breathing repeatedly stops and starts whilst we sleep. And of course, that's not a good thing because when our breathing is stopping, it affects our oxygen levels. And then it puts our body in this state of stress or panic. And of course, that will then affect our sleep and give us sleep interruptions and poor quality sleep. But also there are kind of two main types of sleep apnea. There is central sleep apnea and obstructive sleep apnea. So central sleep apnea is where there is an interruption in the brain signals that stimulate the body to breathe, which causes a breathing pause. And obstructive sleep apnea is probably the most common, where our surrounding muscles of our throat collapse and they create an obstruction and create a pause while we're sleeping.
Yeah, I was actually shocked when we had gone to see my partner's family doctor, and he said that he stops breathing like 40 times a night, which is terrifying. So what are some of the signs and symptoms of obstructive sleep apnea?
Yeah, so some of the probably hallmark signs that we see in a lot of our patients definitely is loud snoring.
There was a lot of that. Hear it from the next city.
Yes, I think a lot of people say this. There is excessive daytime sleepiness or fatigue. Sometimes people will say they wake up with a headache every morning. Even partners witnessing their partners having breathing cessations, as well as waking up with a dry mouth or waking up kind of gasping or choking for air.
And so what are some of the risk factors? Like, I think there's certain types of people who are more susceptible to sleep apnea. So what are some of those risk factors?
Yeah, so some of the main risk factors would be obesity, so a BMI greater than 30%, a diagnosis of high blood pressure, having a large neck circumference, as well as even just a family history of obstructive sleep apnea.
Yeah, I remember when I was telling a friend of mine who's a physician that my partner has sleep apnea, and he was like, does he have a big neck? And I was like, what a weird question. But then I was reading about it and I was like, oh, it actually is a risk factor. So thank you for that. What are some of the health consequences? So again, we hear about sleep apnea a lot, and I don't know if everyone takes it that seriously, but it should be taken seriously. So what are some of the consequences of untreated sleep apnea?
For sure, and I think it's really common what you say. Definitely untreated sleep apnea, you don't see it the next day, you see it over a long period of time. So some of those are medication-resistant hypertension or high blood pressure. Definitely, again, that increased risk of cardiac disease or high blood pressure, as well as issues with emotional dysregulation and mood.
And so I know there's a fix for sleep apnea, and one of those fixes is the CPAP. So what is a CPAP?
Yes. So CPAP therapy is definitely the gold standard treatment for obstructive sleep apnea. Now, what people, I've heard all different names for this, CPAC, different names, but it really is an acronym for what the therapy is. So it stands for Continuous Positive Airway Pressure.
This is a CPAP right here.
Yes. So this is kind of what some people look like. There's many different styles.
Snuffleupagus, that's what I call that too.
Exactly. So basically what CPAP is it's a device that takes room air and pressurizes it, and then it's delivered to you through a mask and a tubing like you see here. And that pressurized air really goes into their airways to help to stent them open. So this way it creates a patent pathway for air in and out of the body, and it pushes back any type of muscles that have relaxed due to obstructive sleep apnea. And there are two other types of PAP therapy. So there is one called auto-adjusting PAP therapy, or APAP, where a range of pressure is set that automatically adjusts to the client's specific needs. And then there is BiPAP, or bi-level positive airway pressure, where they set two levels, one level of flow as you inhale and one as you exhale, and typically associated with higher flows.
Okay, and usually it's your family doctor who will recognize that you may have sleep apnea.
Yes.
So once your family physician tells you that you have sleep apnea, what happens next?
Yes, so definitely going to see the family doctor, especially if you're feeling tired or you're having any one of these symptoms. But what happens from there is the family doctor will refer you to a sleep clinic for an overnight sleep study, or something called a PSG, a polysomnographic study. The results of that sleep study will tell us whether you have sleep apnea or not. And that's when then a sleep specialist or a sleep physician will interpret those results and prescribe the specific type of therapy as well as pressure for each individual. And then that is where our journey begins at Wellwise by Shoppers with our customers, because they'll be bringing in that prescription and we essentially would take them through that, explain what it is, give them tailored equipment selection, and really explain to them, you know, what they're going to be doing with the therapy.
And at the sleep study, it can be a little overwhelming because you go there and they're putting all these wires and little like nodes on you, but it's actually a very helpful study. So could you speak to that a little bit?
Of course, like absolutely. I think a lot of people are sometimes deterred because, you know, they've heard stories or, you know, definitely there are a lot of different wires that you are hooked up during a sleep study, but all of those wires are measuring so many different types of body systems while you're sleeping. So this is a way for the doctors to really determine what is happening and be able to prescribe you something that would be specific for your needs.
Right.
Yeah.
And so once you've gone through the sleep study, and then a sleep clinic will then likely refer you to a place like Wellwise.
Yes.
So what will happen at the first visit? Because again, like the contraption of the CPAP can also be a little daunting. So what happens at this first visit?
Yes, absolutely. So what happens is our customers will come in and our CPAP consultants will meet with them either virtually or in person. Mm-hmm. We will first do a really good health history. We'll ask them questions regarding their sleeping habits as well as the symptoms that they have, because of course everybody's different. Once we get a better idea of who you are, we will then obviously educate you on the prescription of the therapy, what to expect. Again, select that tailored equipment that we think will work the best for you, and really tell you what you're going to expect in the next couple of weeks. And it's completely normal. I mean, this is something totally new that people introduce to their nightly routine. So it's very normal that, you know, there are questions or concerns that come up, but this is why we at Wellwise, we follow up with our clients really frequently within the first couple of weeks to really address any of those problems that they have and kind of nip them in the bud so that this way they are more comfortable and actual long-term users.
And is the CPAP monitored? Like, is there like, are you able to see how the person is sleeping and possibly have improved sleep because of the CPAP? Like, is there a monitoring system?
So most of the newer sleep app devices now are, they actually have modems built into them. Okay. And there are these platforms that us as the CPAP consultant can register our clients and see their sleeping habits and see how long they're sleeping and using the devices. So it's a really good indication for us to really know where we can help them or where we can improve or suggest something else for them.
So it's kind of nice to know that, you know, you have the sleep study, someone is looking at how your sleep is, but then it's also monitored, because it is really important to sort of know that it's improving, you know, so
Exactly.
all those health consequences don't show up later
in the future.
on,
Exactly. And there are a lot of key things that both us and the sleep doctors will look at from those reports to really give us a good idea, is this therapy working and beneficial for the client?
And so in terms of the equipment in the CPAP, how often do I need to change this equipment, which it's often covered by extended medical, which is also a nice benefit.
Yes, exactly.
Right?
It definitely, a lot of our health benefits do cover CPAP therapy and the equipment. But really the CPAP mask and the tubing, imagine, you know, you're using this every single day and you're supposed to be using it every day. So the manufacturers recommend that every 6 months, the mask and the tubing should be replaced, because with normal wear and tear, they can discolor, turn yellow, create foul smells, and of course develop bacteria and dust particles, which can then lead to skin irritation and allergies, and obviously just be uncomfortable. So as long as you're replacing it on schedule, it should be much more comfortable to use and make you want to use it. There are filters on the devices, so those should be checked monthly and replaced as needed. And the actual devices themselves, they do last anywhere between 5 to 7 years.
A funny tip or story is that my cat is actually obsessed with the CPAP mask, and will often steal the mask, and you'll see the tube just running out of the room. So animals also like CPAP machines.
Yes, I've heard that before.
Okay, so it's not just him. So we've talked a lot about Wellwise. So what makes the Wellwise experience different, like as a retailer? And most of us are very familiar with the Shoppers brand. So tell me a little bit more about that.
I think definitely number one is that our CPAP consultants are registered healthcare professionals. So they are registered respiratory therapists like myself, they're registered nurses, and they're registered polysomnographic technicians. So they're really going to be there to provide you that clinical expertise and experience in the field. We also offer the PC Optimum program and Seniors Day discounts. And lastly, we really offer that holistic one-stop shopping. So we have many different products, home safety equipment, supports and braces, continence supplies, as well as mobility.
Thank you. And so my last question is, tell me a little bit about you. So you were a respiratory therapist by trade. Yes. How did you end up working in the CPAP world?
Yeah, so I mean, I am a respiratory therapist. I did actually start off working in the hospital setting, and then I moved into the home care setting, and I'm also a certified respiratory educator, so I do try to put a lot of that in my work. I do lots of direct patient interaction as well in my role, but I also supervise 9 of our GTA locations and work with the consultants there, providing any type of support and clinical help.
That's amazing. It's nice to know that, you know, as healthcare workers, you really care. So it's not just that someone's coming in and getting this piece of equipment or service, but that they're being helped by someone who, you know, is well educated in the subject and actually does care. So thank you so much for joining us today. It was a wonderful interview, and I know I've learned more than I had walked in with. So thank you.
Thank you, Natasha.
Thank you. Besides good sleep hygiene, there are also nutritional aids that can help to aid better sleep. Next up to speak to us about one of these supplements is Linda Bolton. Linda is the founder, co-owner, and CEO of Natural Calm Canada and Bolton's Naturals. Hello, Linda. Thank you so much for joining me today.
Hi, thank you. It's lovely to be here.
Lovely to have you. So I'm going to start by asking the question that I ended with, Sonia. So tell me a little bit about yourself. What is your own personal background and how did you get involved in this industry?
Well, first of all, I worked for the first 20 years of my life as a CEO in long-term care, and I was a director of nursing as well. And then for 15 years, my husband and I were what you call church planters. And then in 2004, we went to Africa for the first time, discovered there were 40 million orphans in the continent of Africa, came back to Canada wondering what we can do to help. And it was right around that time that my younger sister discovered Natural Calm, which was a magnesium supplement only sold in the United States. And she started taking it to help her with migraines. She'd been suffering with migraines for 30 years and had never been able to help herself. Started taking Natural Calm and went from 3 migraines a week to 1 about every 6 weeks. And then I started using it. I was in my early 50s at that time, and I was struggling with insomnia and muscle pain. So I also started using magnesium, and much to my surprise, I was starting to sleep better and got rid of 70% of my muscle pain in the first week.
Yeah, I've seen magnesium, you can take it orally, but then you can also take it as an oil and put it as a topical to help with pain and even restless leg syndrome. So,
that's right.
Yeah,
yes.
it's pretty cool that one mineral can do so many things. So can you tell me a little bit more about the benefits of magnesium and where is it found?
Well, magnesium is found in many different sources, but it actually activates 800 enzymatic processes in the body, but it's not produced by the body. So you must get it either through food, and some foods that contain it are unrefined nuts, grains, and seeds, and leafy greens, but it's really next to impossible to get enough magnesium in your food alone. So you must supplement with it. And there are many different sources. You can take magnesium in a tablet or a caplet. The beauty of Natural Calm is that it's a powder that you dissolve in hot boiling water. So it's highly absorbable. It's actually ionic. So when you take it, you can actually feel it going to work right away.
And why do you need to put it in hot boiling water?
Because it activates it's a magnesium carbonate citric acid that when combined in the hot water, the carbonate gases off and it actually becomes crystal clear and much more absorbable in an ionic form.
And so can you speak a little bit about how magnesium actually works within our body to help with sleep and insomnia, especially in terms of how it works with the endocrine system?
Yeah, it does so many things. But of course, when we're younger, melatonin, which is our sleep hormone, is produced by the pituitary gland. And normally you're producing, proper levels of melatonin, especially by darkness. Darkness activates the pituitary gland to produce melatonin. But as we age, our pituitary stores are also depleted. So I found that when I was in my 50s, I started experiencing insomnia, quite a great amount. It was very, very difficult. Wasn't sleeping through the night. Was waking up in the middle of the night with anxiety and stress and just, you know, what women are like, think too much. And so I started initially just using the Natural Calm Magnesium, which helped to activate and increase your melatonin levels.
Are you getting enough magnesium? Try Natural Calm.
The other thing that it does is it actually will get rid of excess calcium. So everybody talks about the importance of calcium, but you need magnesium to help balance out your calcium. So magnesium actually will get rid of excess calcium in the stores. Calcium's function in the cells is to tense and excite the muscles and nerves. Magnesium relaxes and calms, so it actually helps you have a better night's sleep as well.
So you touched on how melatonin is naturally occurring in our bodies, and I know melatonin is one of those things I've taken a couple times, but then I find that the efficacy sort of wears off, like it doesn't work as well. With magnesium, is that something that I can take for months or years and it'll still have the same effect?
Yes, it will. And well, actually, as we age, our melatonin stores are depleted. So oftentimes a naturopathic doctor or a medical doctor would recommend that you take melatonin and magnesium together. And at Natural Calm Canada, we have a product called Calmful Sleep that contains 2 forms of magnesium. It also contains melatonin, GABA, and L-theanine, which are very, very important for anxiety and stress. So people with high levels of anxiety, that is the absolute best product to take for sleep problems of any kind, really.
And those are all great for anti-aging too. So there's so many benefits. So I read that in the U.S., spending on melatonin exploded 42.6% in 2020, and 40% of people were sleeping worse than in pre-pandemic times. And I'm sure we don't need to go into why, because we're all still living in this world. But have you found the same sort of trajectory with magnesium supplements? That are people sort of exploring magnesium more because our sleep is getting so much worse lately?
I would say our sales have gone up 50% since the pandemic started almost 2 years ago. And a lot of it is because magnesium is so important for stress, for sleep, for getting rid of excess calcium that will build up and cause all kinds of health issues. I mean, magnesium is so important for balancing blood sugar levels, heart disease, just so many things that we experience, especially as we age. And of course, lack of exercise that you experienced during COVID, stress levels go way up. Magnesium actually helps too to balance your endocrine system. So it helps to balance the output of adrenaline and cortisol, which will also impede sleep levels.
So I want to switch gears a little bit. So Natural Calm and Bolton's Naturals are both social enterprises, and the social enterprise concept is one that's very close to my heart because I've worked with so many of them, but I'm not sure if everyone knows what that means. So could you please explain first what a social enterprise is, and second how these companies are social enterprises?
Yeah, that's probably what's most near and dear to my heart. And when my husband and I started our company 16 years ago, as I said, we had just come back from Africa and we were blown away by the poverty there and just so concerned about what we could do to help. So when we discovered Natural Calm and it started doing well, we decided that we wanted to give all the profits after business expenses to help the poor. And initially we were giving the money to an organization that we'd gone to Africa with, and they were using it to build orphanages and schools and drill water wells. But then we started our own nonprofit in 2008 called Organics for Orphans. And through that, we were teaching the poor organic gardening, nutrition, natural medicine, and income generation. So really, it's all about teaching people to help themselves. So as a social enterprise, we're all about helping people through the profits from our company instead of using it for, other means that people would do. And as a result, and I believe it's a God thing, that's just my own personal opinion, but I believe the more that you give, the more you're blessed. And we've been going to Kenya now for about 15 years. And as we've seen Natural Calm Canada and Bolton's Naturals grow, we've also seen our organization, which was called originally Organics for Orphans, it's now called Thrive for Good, and you can find out more information. In fact, my husband just got back from climbing Mount Kilimanjaro.
Oh, wow.
Just 2 days ago, and he did that in order to create awareness and to help the poor climb out of poverty.
That is really amazing. It's nice to hear about businesses who are not just saying that they take on causes, but actually do the causes and put resources towards that. So I think that's a really amazing story that's attached to your company. So in terms of sleep, what do you do? So how do you ensure that you have a good night's sleep? So I'm sure you take magnesium supplements, but do you have any other tips or things that you do?
I do, actually. I cut back on any time on the TV or, you know, on my phone. I go to bed at the same time. My husband and I are early to bed, early to rise, so we go to bed about 9 p.m., get up at 5. Sleep in a very dark room, in a cold room, which is what some of the other people have talked about. And when I first started using magnesium, I was able to use it on its own, but I now use Conscious Sleep, and especially as a continued CEO of a very robust, exciting company and a nonprofit, it can be stressful at times. Plus, I have 10 grandkids, and, you know, so it's, yeah, it's an exciting, busy life, and wouldn't have it any other way, but sleep is very important, and most nights I get 7 to 8 hours sleep. So very, very thankful for that.
You're a good role model.
Thank you.
You're a good role model.
Thank you.
And the last thing I wanted to ask you was just around supplements. So we know like magnesium supplements, any sort of supplement you take, are there any other things you should be watching out for to make sure it's not interacting with anything? Or is there anyone you recommend that people should speak to before they start taking a magnesium supplement?
Yeah, so someone that might be on, say, Coumadin, which is a blood thinner. Magnesium is a natural blood thinner. Calcium thickens blood. Magnesium is a natural blood thinner. And people that would say maybe have severe kidney disease. But you still need to take magnesium because it's one of your 4 essential minerals. You would just discuss it with your doctor or just take smaller doses. What we recommend, for example, someone who might have loose stools, because magnesium is a natural laxative, so you just take it in smaller doses or you just put it in a water bottle and sip on it slowly. So it's a slow delivery to your body.
Is that what you recommend, that when people start taking magnesium, that they start with a smaller amount and then sort of see how your body feels, and then if you could use a little bit more, then you use a little bit more?
Sure, yeah, and probably you should take magnesium twice a day if you can fit it into your schedule, because magnesium is depleted every 12 hours, and usually by the things that we do all the time, like caffeine and alcohol and stress and too much sugar and all of the lifestyle things that we do here in North America. But yeah, it is a good idea to you know, most people can take 350 to 400 milligrams a day. So the beauty of Natural Calm is you can, because it's a powder that dissolves in the hot water, you can put it in a water bottle, sip on it slowly, divide the dose up during the day, and it's even safe for children. Like even children that are problems, you know, a lot of mums are dealing with children that aren't sleeping through the night, and magnesium is very safe and very effective for kids. So it's wonderful that way too.
That's actually really good to know, because I know anxiety is something that's certainly affecting a lot of children, just given our world. So it's nice to know that there's some safe alternatives for things that they can use to help them sleep as well. So thank you so much for joining us and for everything you do, and for the impact that you're making on the world. So thank you.
My pleasure. Thank you so much for having me.
Thank you. Mattresses are fundamental to getting a better sleep, but with so many choices out there, what's the right one for you? Z News photographer Darren Maharaj took a closer look at a classic Canadian brand that's managed to stay on the cutting edge.
Well, with so many different types of beds on the market these days, it's more confusing than ever to figure out which one might be the best fit for you. So I'm here at the Ultramatic flagship store to learn more about the many health benefits that experts say that you'll receive when using one of these famous adjustable beds. Oh, nice pillow too.
If you're having trouble sleeping, you could win an Ultramatic.
Darren, we've got quite a few health benefits, but I'll cut it short for you. One of the major ones is heart. By raising the feet and your head, it helps to elevate and get the blood circulating to your heart a lot easier, so your heart doesn't have to work so hard. Then we also have anybody with lung issues, such as asthma as an example. By laying on your back upright, it helps to keep the lung passages open and the oxygen flowing so much easier.
Something else we hear about a lot is sleep apnea. An adjustable bed actually helps you to sleep more comfortably with the CPAP machine, and it helps to open up your airways, making it more effective. But we've all heard of memory foam, right? But it's an old technology. It was developed by NASA in 1966. And what we've discovered is that it absorbs body heat, makes you hot in the middle of the night. So what we've done is we've developed this thing called nanogel, which is organized in this.
Oh, wow, that feels cold.
It's amazing. It doesn't absorb body heat at all.
Wow, that feels great.
And it's almost like sleeping on air. So if you read in bed or watch TV in bed,
or work from home,
then there's a great feature called the pillow tilt, which allows you to customize just the neck portion or the head portion of your bed when you're looking down at a screen like this. And we've got a lumbar booster, which allows you to boost the support for your lower back as you're working from bed.
Look at this. There's no reason to leave the bedroom.
100%.
So, Adarsh, I understand that this bed, hey, Tina, how you doing?
I'm good.
Is good for couples.
It's great because it gives you the benefit of independently raising your head without having to feel like you have a crack through the middle of the mattress.
I like this. I love this remote. What other oh, does this say massage on here?
Yes.
Oh, man.
With the push of a button, you can start your massage.
Whoa.
For your head and for your feet.
Oh, that feels fantastic. This is like the whole thing is shaking right now.
Yeah. And you can control all of this using an app on your phone.
To learn more about these great adjustable beds, visit ultramatic.ca. And for some more tips on how you can get a better night's sleep, visit everythingzoomer.com. At the border of Oakville and Mississauga, I'm Darren Maharaj for Zoomer News. Time for a quick cat nap.
Thank you, Darren. We're now joined in studio on this amazing bed with Adarsh. So thank you so much for joining us today.
Thank you.
So we know that what you sleep on and how you sleep is so important. And as everyone can see, I am in a different position than we're used to seeing on our beds. So first of all, why don't you tell me, why do we sleep flat?
That's a great question. You know, we know from observing animals that bats sleep upside down, elephants and horses sleep standing up. So, you know, there are other ways to sleep,
right,
but they're physiologically designed that way. We need to rest our muscles, so we're designed to sleep flat, sleep horizontal. But once we're horizontal, there's nothing to say that we need to sleep completely flat on a flat surface.
I actually sleep upside down like a bat. I don't know if you knew that about me. No?
I didn't know.
So I actually have this bed. So why don't you tell me why an adjustable bed is the smart choice? So why is this better for your health? What are some of the health benefits?
Well, you know, the number one reason, of course, is for your back. By being able to elevate your feet, and I'm going to do that right now. I'm going to actually get you down into a sleep position.
I get to sleep. This is the best interview ever.
Here you go.
Okay.
I'm lowering your back as we speak right now. There you go. Don't fall asleep.
You'll be fine. You can take on the rest of the show. It'll be fine.
And what I'm doing is I'm elevating your legs as well.
Oh.
Okay. So what that does is that takes the pressure off your lower back and shifts your weight to your buttocks.
And this pillow is fabulous too.
Yeah, absolutely.
Tell me about this pillow.
So this pillow is made from nanogel.
Nanogel.
It's on the top, it's got this surface of gel, which is very cooling and allows your body to allows the pillow not to absorb your body heat.
Yeah, this is great.
Yeah. So what I've done now is I've lowered your back and I've elevated your feet here. And what that's done, shifted your weight and taken away a lot of pain from your lower back.
Yes, because that is, I find as I'm getting older, I'm going to come up so people can hear me. Yeah. As I'm getting older, my lower back hurts more when I get out of bed, which means I'm aging, doesn't it?
No, not at all.
No, not at all. So why don't you tell me about some more of the health benefits, like even digestions, how you sleep actually affects your digestion?
Absolutely. So if you've got acid reflux or indigestion or GERD, this allows you to digest your food much easier just by sitting up.
Right.
And you know, and often those interrupt your sleep during the night.
Yes.
So by not being able to interrupt your sleep, by having a full sleep cycle, you have a more regenerative and restorative sleep.
And one of my favorite buttons on this remote, and I don't know if you could show this to people, is the button that says anti-snore. So what you're telling me is that if I take the remote from my partner's side of the bed, I can press buttons and move it around while he's sleeping, so it'll stop him from snoring. Is that what that means?
Absolutely.
Okay.
You can do that. You can do that. And of course, you got to steal his remote.
Yeah.
But you can actually use an app as well to do it. So if you've got the app installed on your phone, you can change his level as well.
And if you're a trickster like me, then you can change the level of the bed from another city. So you can move his bed around while he's sleeping just to mess with him. Is that what you're saying?
You could if you're on the same Wi-Fi.
Oh, okay, it's the Wi-Fi thing.
Yes.
So in addition to health benefits, this bed is also great for our lifestyle. So why don't you tell me, like, you know, if you're a Netflix person like I am, how is this bed good for your Netflix?
It's great for sitting up in bed.
Right.
And, you know, they're built for the modern age. they've got USB ports, they've got massage. They've got an app for your phone, and they've got underbed light, so you can move in and out of bed in the middle of the night and being able to see where you are. But you know, you can by being able to sit up in bed, it just makes it easier to read in bed, watch TV, and have that correct posture. Right.
I love working in bed. That's my thing. So for me, this bed is perfect. So in addition to the mattress, temperature regulation is also really important when we're sleeping. So can you talk to me about temperature regulation? And I know NASA was behind some of the science behind this bed. So tell me about the temperature regulation.
Yes, you know, we live in Canada, Natasha, like 4 seasons. We've got hot and cold weather, and it's actually the #1 reason why people wake up in the middle of the night.
Right.
You know, besides we heard about stress and some other things like that, but in terms of environmental factors, temperature is a huge reason. So if you can have a sleep surface that doesn't absorb your body heat, that's what's really important. And today you can get mattresses made out of memory foam, which are infused with things like gel, copper, and graphite, but they're still made out of a foam surface.
Right.
What you should look for is a surface that's made out of pure gel, if you can.
Okay.
And actually, what you're sleeping on right now, I don't know if you can rub your hands over that top there. On this sleep surface, you've actually got a matrix of gel columns.
Right.
So you're sleeping on air just as much as you're sleeping on a surface.
Yeah, I wish you could all feel this, because it actually feels very nice and jelly.
Absolutely.
The temperature regulation is very important. So also when we think about the position of the bed, so I notice on our remote it says something that says 0 gravity. So what does that mean? You
may have heard this, you know, when you're recovering from surgery or from after a heart attack, if you've ever had, you know, unfortunately, you know, hope you haven't had that, but a lot of people have. And doctors often say, elevate your feet and elevate your chest. And the reason for that is you want your blood to be able to flow much easier through your whole body. And by elevating your feet and your chest, you allow that blood flow to happen much easier.
So it's the perfect position for your body to be in, is sort of this 0 gravity position.
Exactly, exactly. It's almost like you're floating.
Right. Yeah. I like that. I like floating. So do you have any last thoughts or tips and tricks in terms of what people need to keep in mind as they position themselves for a better sleep?
I think, you know, we've talked about being able to sleep with your legs elevated, your back elevated. This particular bed has a lumbar booster, so you get that proper posture, an extra back support. I'm just raising it right now for you.
He's moving it right now. I can feel it.
You can see the bed lifted there. And this bed has a pillow tilt, so it allows you to have that perfect posture for your neck and support, so that you have your airways open. So just as important as your bed, I think, is also the pillow.
Yes.
Look for a pillow with these innovative cuts in them. Pillows which are called cervical pillows, anatomical, or even shoulder cut pillows.
The pillows make a huge difference in your sleep. So thank you so much. Everything you've told us today has taught me so much more about sleep positions. This mattress is amazing. I can attest to that because I have one. So thank you, Adarsh. Thank you for joining us in studio today.
Thank you.
So when it comes to sleeping better, we should use every tool that we can, especially when it's free and easy. We're now joined by Deborah Devine, host of Healing Yoga on One TV and Vision TV. Deborah is going to teach us a few simple stretching and breathing techniques that can help before bedtime with insomnia and better sleep. So thank you so much for joining us.
Thank you for having me.
So I'm excited because we actually get to move a little bit and do it from our chairs, and you're going to show us some easy stretching techniques that we can do to help with our sleep.
I've got a special technique. Let's begin. We're just going to start seated.
And everyone at home can follow along, so let's all do this together.
Please do. So just find your seat and find your feet. Feel connected to the ground. And this practice is going to require us to slow the breath down and use our mindfulness to access the inner sensations. We're going to be doing a gentle movement with the right ankle, circling around. You can take your leg out and circle a few times one way, a few times the other way, breathing and just feeling some of the tension dissipating. And then we'll switch over to the opposite side. Yoga and meditation and the sister science of yoga, Ayurveda, the science of health and wellness, has given us many wonderful tips for insomnia over thousands of years. Let's come back to seated. So we worked on the feet and the ankles. Now let's work on the knees. We're going to lift and lower the legs.
can feel some crack in there.
Yeah. And then while we're doing that, we'll just kind of rub around the joints. The knees are really sensitive, especially as we get older, so just a little bit of circulation on that. Starting to feel a little bit more relaxed. Now we're going to get nice and tall through the spine. The front of the spine is nice and long. The back of the shoulders are coming down. We're broadening through the collarbones. Lift up through the front and then exhale as we come forward. We're just going to get a little bit of flexion through the spine and flexion of the hips, and then we're going to inhale and come back. And we'll take the arms out and up, reaching, and exhale, float the arms down. A couple more. Inhaling out and up. And then exhaling, floating the arms down. Floating is part of the art of yoga, even though there's so much science behind how yoga is excellent for relaxing. Let's bring the arms back down now. We did a little bit of a forward bend and we did back bend. Now we're going to do a twist. So inhale, get long. Exhale, turn to the left. Let your neck continue to turn.
And this feels so good on your back.
It really does. And then after a few breaths, come back to center. Circle the shoulders around. Feels like we're loosening up the diaphragm here, right? Let's go to the opposite side, exhaling into the twist, shoulders down, heart is rising, and then we come back to center, circling the shoulders again. And then we'll just think about a pencil coming out of the top of the head and draw some very small circles on the ceiling. You can close your eyes or lower your gaze, just soften your gaze. Then you go around a few times in the opposite direction. And then we'll turn the neck down, tilting over to one side, to the left or the right, and then back up to center. Nice breath here. And then opposite side, coming back up. And then we'll tuck the chin down, and then bring it back up to center. And then lift the chin and squeeze through the muscles of the back of the head and the neck, and then come back to center, circling the shoulders and then circling the wrists out. How does this feel?
I feel like I'm ready to sleep. It feels so nice.
Isn't this great?
This was so wonderful.
There was a study in 2012 that showed that postmenopausal women can reduce their symptoms of insomnia through a very gentle practice like this before bed. So it really works.
And that's so good to know, because it's like these are the easy things that we can do for free that help us with sleep and our health. So thank you so much for joining me today. And thank you to all of you for joining us. I feel very calm and relaxed now. For more information on better sleep and other health issues, visit carp.ca. Thank you so much for joining us for the Better Sleep Summit. Goodbye and good night.